Hello, and welcome to the Massachusetts General Hospital Epilepsy Monitoring Unit, also known as the EMU. My name is Dr. Lamb, one of the epilepsy doctors here at Mass General, and I'm also the medical director of the EMU. This video will talk about the purpose of an EMU stay, introduce you to key members of the care team, and provide you with a better understanding of what to expect during your upcoming stay. For most of our patients, the goal of an EMU stay is to better understand your seizures through video electroencephalogram monitoring, also known as EEG monitoring. We'll continuously record your brainwave activity on EEG while you're in the EMU, and this will allow us to understand what your brainwaves look like during a seizure, and also where in the brain your seizures are coming from. You'll also be continuously recorded on camera so that we can review what happens to you before, during, and after your seizures. Because we need to record at least a few of your seizures, we'll typically lower or even stop your anti-seizure medications during the first few days you're in the hospital. This could raise your chances of having seizures and hopefully lower the amount of time that you'll need to stay in the EMU. We may also try to help you have a seizure. Sometimes we'll use bright blinking lights, ask you to use an exercise bike in your room, or have you stay awake until 3 a.m. These are common seizure triggers for many of our patients, and while these may sound overwhelming, our care team will be with you the entire time to make sure you feel safe and well supported through the process. We understand that having seizures on camera or in front of other people is scary, and many people have shared concerns that they may behave strangely or aggressively during or after a seizure, or that they might lose control of their bladder or bowels. We know that this can feel embarrassing and uncomfortable. We also know that these behaviors are not under your control, so please know that we've taken care of many people with epilepsy in our EMU for over 20 years, and we'll do everything that we can to make sure you feel comfortable and safe and are treated with respect in our EMU.
Hello, my name is Tabitha, and I'm one of the neurology nurses on Lunder 8, where the EMU is located. On the morning of your EMU stay, the resource nurse will call you to let you know what time to come into the hospital. Sometimes there can be a delay in having you come in, especially if the hospital is full. We ask that you wait at home until you are called by the resource nurse in case a hospital room is not available on that day. Here is a checklist to help you prepare for your EMU stay. Please wash your hair the night before or the morning of your scheduled stay. This will help the EEG leads stay on and work better. You cannot shower or wash your hair once the EEG leads are on your head. You will be able to sponge bathe with the help of a nurse or nurse's aide. You will wear hospital-supplied clothes due to the monitors and cords attached to you. You may bring pants and any tops that zip up or button up. Your hospital stay may be anywhere from 2 days to 2 weeks or longer. Most of your time will be spent sitting in bed in your private hospital room. Please bring electronics, games, books, and other items to keep yourself entertained. If you can bring chargers with long cords so that you can use your electronics while sitting in bed or in the chair. Please bring an updated list of your prescriptions, over-the-counter medications, and any supplements you are taking. It is important for us to ensure we are giving you the correct medications, not just for your seizures, but for any other medical conditions you may have. We will provide you with breakfast, lunch, and dinner menus with a variety of food options for you to choose from. Although we can accommodate most diets and allergies, options may be limited. You may bring snacks to keep in your room and a small supply of refrigerated food that we can store for you. You are welcome to have family and friends come to visit you while you are in the hospital. Visiting hours are from 11 a.m. to 8 p.m. Overnight guests are typically not permitted. Visitors may park in any MGH parking garage, and tickets can be validated for a reduced rate at the garage's parking office.
Hi, my name is Kara, and I am the Chief Technologist for the Epilepsy Monitoring Unit. On the first day of your EMU stay, you'll meet a member of my team who will apply the EEG leads to your head and set the equipment so we can start your video EEG recording soon after your arrival. You will see us throughout your hospital stay, as we will need to maintain those leads to make sure we get a good quality recording for the doctors to review.
There will be 2 teams of doctors working with you during your stay: the primary neurology team and the epilepsy team. These teams work very closely together and will visit you every morning to provide you with updates and to share the plan for each day. Once you arrive to the EMU, the doctors will ask you questions to learn more about your seizures. You may want to have a family member with you during this time to help describe what your seizures look like and how often they happen. You will always have a nurse assigned to you while you are in the hospital. Your nurse will make sure that you are safe and comfortable during your stay and will be responsible for giving your medicines. They will also occasionally perform neurological assessments and monitor your heart rate, blood pressure, oxygen level, and other vital signs. These assessments happen during the day and throughout the night. We have 24/7 access to interpreter services here at Mass General. If English is not your primary language, or if having an interpreter would make you more comfortable, please let your nurse or doctor know before at any time during your hospital stay, and we will provide an interpreter for you. Safety is our number 1 goal in the EMU. Because you will have a higher risk of having seizures, we need to keep a close eye on you to make sure you are safe. We will place an IV line in your vein once you arrive at the hospital, which you will have throughout your stay. This will make sure that we have IV access in case you need to give rescue medications for your seizures. We will ask you to stay in your hospital bed most of the time while you are in the EMU. In some cases, we may allow you to sit in a reclining chair for a few hours during the day. You will need a nurse or nursing assistant to accompany you when you are out of bed, including when using the restroom. Our beds and chairs do have alarms on them, in case you try to get out of bed or chair on your own. Often, this can happen if you have a seizure and are confused. A nurse will come to check on you whenever the alarm sounds. We understand that all of this may feel intrusive or bothersome, but is really for your own safety. We will try our best to respect your privacy. Now let's take a look inside an EMU room. You will have a private room with your own bathroom. This means that you will not have a roommate. Our EMU rooms are designed to keep patients safe during seizures. The bed and floor will be padded for your safety. In addition to the EEG, you will be connected to several monitoring devices that keep track of your heart rate and oxygen levels. The room is also equipped with other seizure safety supplies. You will have a seizure button with you at all times. You should press the button if you feel seizure-like symptoms. Family and friends should also be aware of this button when visiting, so they can push the button if they notice you are having a seizure. The nurses will check the seizure button every 4 hours to make sure it is working properly. If you have a seizure or push your seizure button, your nurse will come into your room and make sure you are safe.
Once you have enough information from the EEG and have a better understanding of your seizures, your EMU team will explain the results from your stay. Your home anti-seizure medicines will be restarted the day before you leave the hospital, and your doctors will discuss any changes to your medicines with you. We'll ask that you identify a person who will be able to drive you home after you're discharged from the hospital. If you're unable to get a ride home, please just let a member of your care team know. We do have support services that may be able to help. We hope that this video has been helpful in preparing you for your EMU stay, and we'll look forward to taking care of you. And we'll do our best to make sure this experience is as safe and as comfortable as possible. Please reach out to your neurologist if you have any other questions or concerns. Take care.